Hi, today I'll talk about COVID and immunity. The second wave in India is slowly coming down, and people are feeling more confident now, and they are now thinking about the next wave, which is predicted to affect children mostly. So, the parents, especially the mothers, are keen to find out about immunity boosting medications or methods. A short answer is that every child is born with 100% well formed immunity, and there is no particular medicine or technique that will boost the immunity. There are various ways in which we might damage our immunity or make it less efficient than it is supposed to be normally. I'll explain that further down the talk. So, the child, when it is born, it has 100% immunity. It is able to fight any infection. So you might ask, then why should we need vaccines if we are already born with 100% immunity? The reason is that the infection, whether it is a virus or a bacteria, if it gets into our body, then the immune system starts to recognize it, and then it starts its factory to manufacture the antibodies which are to attack the bug and eliminate it. By the time this happens, it might take few days, and by then the bug would have spread to various parts of the body and started to cause damage, which is what happened in COVID. So by the time the body recognizes and forms the antibodies, the virus might have attacked the lungs, especially in most people, and the heart, the intestines, the kidneys, etc. etc. So, by vaccination, what we do is that we take the most recognizable part of the bug. In COVID, it's the spike protein, or we take the whole of the virus and then we introduce it to the body so that the body recognizes it and immediately knows that this is a foreign thing and starts to produce antibodies. And also there are certain cells which remember this, so that even if the antibody level goes down, these cells are hiding in our system and they are waiting for a chance, and the moment they recognize that the foreign protein or bug has entered the system, they are alerted and they spring into action. So this is the concept behind all the childhood vaccines like polio vaccine or the MMR vaccine or the DPT vaccine, hepatitis vaccine, etc. etc. So before the infection gets into the body, we introduce the harmless version of it, either a living virus which is not harmful at all, or parts of the virus or bacteria, so that the body can recognize and produce antibodies and be ready. The moment it faces the invader, it can eliminate it. So that's the reason why we need vaccines, and that is the method of action of the vaccines. Now, how do we know that somebody's immune system is present? We don't have to do many tests, and just by listening to their story or knowing the progress of their life, we know their immune system is good or bad. So one indirect way of knowing whether a child's immune system is good or not is by seeing how they react to many of the live vaccines like BCG, MMR, chickenpox, or rotavirus, etc. etc. If a child has even a mild deficiency of immunity, then they are at high risk for having diseases caused by these live vaccines. So a child who has passed through 15 months or 2 years of age without any major illness like this, we know that their immune system, especially towards these viruses, etc., is excellent. So we don't worry that much about it. Then the other way we know somebody's immune system is good is, especially in a place like India, where we are a tropical country and we are exposed to lots of infections, viral infections, etc., etc. So if we do not have recurrent chest infections or sinus infections or ear infections or diarrheas, etc., then we know that we are having a good immune system, because the body's immune system only fights against the bug. Antibiotics, etc., they are just a, you know, they give support to the body. They are not actually killing that, even though we perceive it like that. So it's the body's immune system which is the primary worker eliminating these bugs. And there are other important defenders of the body, especially the skin, the lining of the lungs, the lining of the intestines, etc. These are also very important parts of our body's defense against foreign organisms. Another very important defender of our body is the billions and trillions of bacteria and other organisms that are on our skin, inside our whole respiratory system, inside our nose, throat, and the air passages to a certain extent, and especially in the intestines. The intestines are full of bacteria which are very good for us. They are there for the protection of the body, they are there for the digestion of the food, and they are also there for training the immune system to be tolerant and not hurt everything in the body. And it's a very interesting thing that the bacteria are there, the immune system doesn't attack them, but the moment a dangerous bug gets into the system, then we immediately are able to recognize it and eliminate it. And if the body is not able to eliminate, then we develop some diarrhea, vomiting, etc., etc., and then we take antibiotics to help the body defeat it. So that's the function of the gut microbiome. The important thing to remember is that the stomach has got acid, which also helps in a very important way in eliminating the bacteria. So that's why I think in South India we are eating more of tamarind, which produces acidity. So any bug that goes in, if it meets this tamarind developed acidity or the natural acidity, it's eliminated. So it's very important not to pop in pills like Lanzol or antacids, etc., just because we think we have got a gastric problem or gas problem, etc., etc. That actually hurts one of the early defenses of the body. So that's why we have to be very careful when we take these medications. And also nowadays lots of people are popping in azithromycin or ofloxacin, etc., thinking that there is something wrong with my tummy, I'm having diarrhea, etc., etc., and that destroys the diversity of our gut microbes or the bacteria living there, which is called the microbiome or gastrobiome. And we are actually killing our own defenders. So if we take it irrationally, then we are eliminating them, and to reconstitute them might take a long time. So we should be careful in these COVID times not to be doing these irrational things. Many people are now trying to find out if zinc, vitamin C, vitamin D, etc. will help improve or boost our immune system. There is no evidence for that. The only known factor is that slight deficiency of these can cause a slight immune problem. But there is no evidence to say that excess of these will have a much more protective effect. And those people who have normal intestines, that is, they have not had any intestinal surgery where a part of the small intestine has been removed, or they have no diseases like Crohn's disease, which is an inflammation of the intestine, which affects the absorption of nutrients into the body. Then these two or three types of conditions can cause us to not be able to absorb the nutrients, and they might be at high risk for deficiency. Again, there might be some parents who think, oh, my child is a fussy eater and he's not taking a variety of food, so he'll be at high risk for deficiencies. But that is also not true, because fussy eating is a part of childhood. It's a normal development from about 15 to 18 months up to 4 or 5 years. Most children are like that. We have all grown up like that. but we have forgotten that we were like that. And even in adult age, lots of people are very fussy. Now, if they are having extremely rigid and strange diets, then they have to be really careful about their vitamins and minerals, etc. So, if somebody is on a normal diet and they are eating lots of grains and greens and fruits, which contain all these essential nutrients, I think they should not worry. They don't need to pop in all these pills, zinc, vitamin D, vitamin C, etc., etc. But I can't tell about homeopathy or Ayurveda because I don't have specialist knowledge of that. I can talk about the Western system of medicine, which is locally called allopathy, and we don't have any particular immune boosters in our system. I told you about how we can indirectly recognize, whether our immune system is working well or it is fully constituted or not. There are other symptoms by which we can know if we are having an immune deficiency or not. They are like recurrent ear infections, like more than 2 to 4 ear infections in a year, or recurrent sinusitis, or oral thrush, white patches in the tongue persisting for a long time in a child or in an adult, or recurrent pneumonias, more than 2 pneumonias, or recurrent diarrheas involving the intestines, then loss of weight in a child, or faltering growth in a child, or loss of weight in an adult, recurrent deep-seated abscesses in the skin or abscesses in deep organs of the body, requirement for IV antibiotics for even for minor infections, or prolonged courses of antibiotics for treating infections, or people who have other family members who have got immune deficiency. But not just one of this, a combination of these, 2 or more of these various things that I told, or people who have had cancer treatment, or they have had other reasons for taking steroids, etc., etc. These are the people who have immune deficiency. And talk to our regular doctor and see if they would like to undertake any diagnostic tests for checking our immune system and how good it is. At the end, I would say that it is important for us not to be popping in pills, but to try and encourage the children to eat a good diet. Even if they are fussy, we keep trying various attractive ways of cooking the same food or different foods and see if that will help them to improve their diet. We should not be confrontational. We can go with them and see what they like, because they might like a particular food for 3-4 days and suddenly they may go off it for about 3 months before again starting to like it for another few days. So we need to be patiently working with the children. Again, it is also important to think about giving them food which is from natural sources. We cook the vegetables, etc., etc. So that teaches them that it is important to take natural food rather than taking pills like multivitamins, etc., etc. Nature itself has a diverse variety of fruits and vegetables, and it cycles them throughout the year. So each fruit or vegetable or grains has got its own important qualities. So when we rotate the fruits and vegetables and grains throughout the year, then we get small portions of everything throughout the year, and our body is fully protected or fully replenished with all the vitamins and minerals. And you might find a lot of ideas about how to improve our lifestyle, how to avoid obesity, how to avoid smoking, how to avoid drinking, etc., etc., which can be harmful to our health and especially to the immune system. Also, keeping an alert, active mind and not getting very depressed is also a very important part of maintaining our immune system. So I hope you feel confident, be happy, be safe. Thank you.